I have to live stream on YouTube. Yes, Miss Elvia, you could start the webinar.
Okay, so Mas, can you
Yes,
start?
yes,
Okay,
yes,
can we start now?
yes, Nadifa, please.
Okay, good morning, everyone. Let me introduce myself first. I am Diva, and I'm from Universitas Indonesia. Will be your host here in this online seminar. First of all, I would like to introduce AJCE to you. AJCE, or ASEAN Journal of Community Engagement, is an organization in Universitas Indonesia that publishes journal related to community engagement. This online seminar is dedicated for, but not limited to, researchers, students, scientists, and community who are working on community empowerment, reporting on engaged research, community-based research, action research, and community services, as well as improving the knowledge and practice in the field of purposive community engagement. Today, we have Dr. Elvia Shauki from Universitas Indonesia and the University of South Australia. She is the one of the editors of AJCE, and she will be our moderator for this seminar. We have three distinguished speakers today. They are Professor Hurriyet Babacan and Dr. Narayan Gopalkrishnan from James Cook University, Australia. Also, Prince Agwu from University of Nigeria, Nigeria. Now, I will let Elvia to lead this online seminar. Please.
Okay, yes, thank you. Thank you so much, Tifa. I'm going to share the files, the CV from the three distinguished speakers. So I hope you see it. Can you confirm that you see the screen, Tifa? Yes, is that all right?
Yes.
Okay,
Yes.
good.
I think we need it a little bit bigger,
Okay,
so everyone can read it maybe.
yes, okay, good. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera for everyone. So my name is Elvia Shauki, as Tifa already introduced to you. I'm going to read the three distinguished speakers that we have today. We are very, very honored to have these three distinguished speakers. So the first one, we will have Professor Hurriyet Babacan. Professor Hurriyet is the research director at the Rural Economic Center of Excellence at James Cook University, GCU, and she holds two bachelor's degree in economics and social works, master in public policy, and a PhD. Hurriyet has a distinguished career over the last 25 years in senior roles in higher education and the public sector. I'm not going to read all of the CV, the bio of Hurriyet, but you can see it here that she has been rewarded and awarded by many distinguished and many reputable scholars, as well as recognitions around the globe, not just in Australia, but also from any other countries internationally. The second speaker is Dr. Narayan Gopalkrishnan. Narayan is the course coordinator and the Bachelor of Social Coursework and is a fellow of the Keynes Institute at James Cook University. So Narayan holds a range of qualifications, including Bachelor of Commerce, Master of Business Administrations, and PhD from Curtin University in Australia. Narayan also has some works in social enterprise and also social works that is listed here. I'm not going to um, read it all of them, but he has written a guide for the Queensland government as well as in culturally and linguistically diverse communities. So community engagement for the two distinguished speakers are not something new, and they're very, very experienced with regard to this field. The third speaker is Prince Agwu. Prince Agwu is a Nigerian scholar and a lecturer at the Department of Social Work, so similar with Narayan, and the Health Policy Research Group of University of Nigeria. He holds first class in social work from the University of Nigeria and master in social policy and social works from the same university. Has published the local and international journals and also columnist and blogger. So you can follow him as well all of his works related to social work. So without further delay, I just want to give the floors first to Narayan and to Hurriyet, to distinguished speakers first. They're going to talk a maximum of 30 minutes, and then it's going to be ended with questions and answers. And after that, we will questions and answers last about 30 minutes, and then we will have Prince Agwu talk later after the questions on and answers after the first speaker. So time is yours, Professor Babacan and Professor Gopalkrishnan. So thank you so much. Time is yours now. And I give you the share here. Thanks.
Good morning, everyone, and thank you very much for joining us. I'd like to thank the ASEAN Journal of Community Engagement for inviting us. We're very pleased to be making this collaboration with Indonesian University and the journal. Today, our topic is COVID-19 and engaging the vulnerable. We have been doing a lot of work in Australia around COVID-19, looking at localized studies. We've just finished doing one for Cairns City Council and this municipality. I work in a research center of excellence that's across 4 universities. So we've been looking at the economic impacts through that center. So we, rather than talk to you about a lot of the specific studies, what we thought we would do is talk to you about how do you engage the vulnerable. Why do we engage the vulnerable, and what are some of the frameworks that we may draw on to be able to do this? So the coronavirus is, as you know, a pandemic. It has had lots of impacts, including different aspects of society, population groups, and different cohorts. Many have described it as a health emergency, but it's also a health-driven socioeconomic disaster. So I think it's important to bear that in mind. And also the impacts will be very deep, long, wide, and enduring and persistent. We start with a focus, if you're looking at the vulnerable, a lot of the times the vulnerability comes through global forums and global processes. Many of you will be familiar with the Sustainable Development Agenda. I know there are criticisms of that. We're not going into the discussion of the SDGs at the moment, but it certainly identifies 17 key areas in which human life is impacted globally. And what we're saying is that these provide a framework to view the impacts of COVID-19 in terms of domains of life and domains of community. Over to Narayan.
When we're talking about these kind of larger picture, frameworks and looking at all these things, I always come back to this image that I'm showing you today. This is a photograph of a young man called Rona, who I came to know quite well when I was working in a community development project up in the remote northeastern part of India, a forest area. Now, Rona was hearing impaired. He was also mentally challenged. He used to frequently get epileptic fits, due to which he'd fall down, get grievous injuries, infections which would last for long periods of time, and still keep smiling. Despite all that, you can see he was a very cheerful young man. Now, what was really important was he lived in an area which was very remote. It took about 4 hours by dirt road to get there. His family and all the families in the area earned less than $25 per year. Growing everything they grew, whatever little income they got by daily wage labor, all of that put together was an average of $25 per year across that whole area. Now, in that kind of setting, young people like Rona were at great risk. And the sad thing is that Rona didn't live very long. After I left the project, within a couple of years after that, Rona passed away. But the important thing to recognize within this is that when we work in times of pandemic, we cannot just think of everybody as being the same and do things accordingly. We need to look through diverse lenses. We need to look at low socioeconomic lenses. We need to look at rural, urban. We need to look at age. We need to look at ability. And Rona, to me, represents all of that. And I'll keep coming back to him when we're talking through the rest of the slides. So Sorry, there's some of these things which are actually blocking the slides. Okay, so some of the examples of inequity when we think about it, the 1 in 9 people goes hungry every day. Women own less than 10% of the land. They receive only 5% of agricultural extension services, and yet they contribute significantly to agriculture and food production, as those of you in Nigeria, those of you in Indonesia, across many parts of the world. In India, where I come from originally, women are major contributors to agriculture and food production, and yet they get very little of the benefits from it. The greater percentages of women continue in casual, informal, and vulnerable employment, all of which are deeply impacted on by what is happening around us today. The UN Women's Forum identifies 80% in Southeast Asia, 74% in Sub-Saharan Africa, and 54% in Latin America, which is substantially less than the others. But nevertheless, there is a significant area where women are at risk. Nearly half the world's population do not have access to essential health services. And in a time like this, that becomes even more of a problem. From 2013 to 18, approximately 40% of all countries had fewer than 10 medical doctors per 10,000 people. So how do we cope with all this? I mean, you look at China, look at India, enormous populations that they have to service somehow or the other in this kind of context. So the problem is that crises amplify vulnerability, where people are already vulnerable, such as Rana, who was very vulnerable under normal circumstances. But crises amplify that and exacerbate pre-existing inequity. So we have to think about ways by which we're going to do things differently to enable us to deal with some of these situations. The other aspect to think about is inequality. On the left-hand side, you have the percentage of people who own 45% of the global wealth. 1% of the population owns 45% of global wealth, whereas 64% of us altogether own only 2% of global wealth. So if we had $100, one person would own 45, and 65 people would come together to own $2. The rest of us share the rest in that. This is hugely problematic when it comes to vulnerability, when it comes to risk. All of these impact on how we can do things going forward. And we live in a globalized world. We are increasingly connected. We are interdependent. What happens to one of us affects others. Quick shocks are felt. COVID started, by the end of 2019, we started seeing the effects of that. And by halfway through 2020, the entire world is impacted on by it. So shocks are spreading very quickly. While we continue to be embedded in place, we are embedded within our communities, we're embedded in our place, but we're increasingly vulnerable to global risks, to risks that, one country you might have forest fires, that impacts on the countries around us. Pollution from one country impacts on another country. So shared risk is a major factor in today's world. And unfortunately, we keep searching for answers in markets. We keep saying that the solutions are in markets. Markets do a very poor job when it comes to extremely marginalized groups. And vulnerable populations are particularly at risk if we depend only on market-based solutions. Our institutions of democracy, our institutions of service delivery, our institutions of mutual support, the way that traditional societies used to support each other, all of them have become increasingly fragile and are easily disrupted in today's world. The social capital that existed, traditional communities like the ones I've worked with, everybody shared everything, but that doesn't happen. Westernization, modernization has led to separation, and that social capital is disappearing. The increasing gap between the rich and the poor is escalating, even in countries like Australia. I live in Australia, and I can tell you here in this country, the gaps between the rich and the poor is increasingly expanding. All of which takes us forward towards looking at what's happening in the cycles of disadvantage.
So coming to a point in which we need to start looking at, well, there are all these inequities. What does that mean? It means that there's a cycle of disadvantage that takes place, and we could be anywhere in the cycle of disadvantage. You could be in a point of birth, early childhood vulnerability, schooling, in the work, labour market, opportunities in education, and then housing and poverty. At the centre of the circle is social and economic inequality. So depending on where we are across the lifespan, whether we're in the birth or labour market, the cycle of disadvantage is impacted by COVID. And what it impacts is around entrenched disadvantage that has been possibly intergenerational. We know from, for example, studies of unemployment that's intergenerational and can last over 5 to 6 generations. It's persistent, it doesn't go away quickly. Solutions are complex, they're not easy. So where are our communities in the cycle of disadvantage when we're looking at remedies and engagement during COVID times? The issue of vulnerability emerges as a major consideration. Vulnerability often is used in disasters, and we're going to touch upon whether a pandemic is a disaster or not in a minute, but vulnerability is the degree to which populations or individuals can cope or resist or adapt and recover from disasters. And to the extent to which these issues are mitigated or how we can impact them depend on what are the risks and what are the protective factors. Now, if we look at the right-hand side, you see 3 circles. There are some intersections across those Venn diagrams, but some of the areas of vulnerability are physical and health-related, others are behavioural, and others are social and economic, institutional and structural and societal. And these vulnerabilities can operate at scales, at micro scale, at meso scale, at a whole macro scale. And these then reflect on individuals, families, communities, nations, and society. KPMG, who's a major economics firm across the world, has recently done some work around looking at vulnerability during COVID. And they remind us that people or communities with particular characteristics can suffer real adverse harm during COVID. They're particularly vulnerable. Secondly, vulnerability is much higher if you have a set of intersecting characteristics. For example, if the Rana's example that Narayan used, he had physical disabilities, he had mental health challenges, he had normal health challenges, he had societal challenges in access to healthcare and remoteness. So vulnerability can change during COVID. Now, it started at the beginning of the year, we're into 8 months of it now. So that vulnerability is context and time specific, and people who were not vulnerable at the beginning of the pandemic may be vulnerable depending on the changes. So it's important to remember that vulnerability is not a fixed thing. So some of the groups that have been identified as vulnerable from research around the world includes older adults, those with comorbidity and joint health issues, the global poor, those who suffer homelessness, women. The levels of domestic violence, domestic and family violence have really increased around the world. People with disabilities, refugees, temporary visa or temporary entrance, and those numerous displaced people around the world, and internal displacement, indigenous communities, children and young people are just some of the groups that have been identified as vulnerable. Of course, we haven't got time to talk about the specific characteristics of those vulnerabilities, but this is what we've gleaned from our research into COVID-19. I wanted to just share some examples of the impacts of COVID-19. On the left-hand side are the global, and on the right-hand side is some information and a quick look at our region. Now, we live in far north Queensland in a town called Cairns. You look at the map of Australia that's there, you'll spot Cairns. It's a tiny, small, beautiful place based on tourism. It's a lovely natural environment, and main industries are agriculture, tourism, and social and community services. But if we take the big global impacts, the International Labour Organization is predicting 25 million job losses, 20% contraction in income, and people living below poverty lines, however it's defined, the relative poverty, is going to increase by over 500,000 people. Numerous examples of financial toxicity and financial stress hardship. Digital access. Many of the world still does not have digital platforms. We now, look at us doing everything digitally. A lot of information, a lot of services. The way we do work has shifted to digital platforms as a result of COVID. UN, and this is their language, use least developed countries. I know there's some issues with that language, but argues that 1 in 5 people in least development countries use the internet only. Key issues in having access to the internet, having infrastructure like towers, affording data plans, and having digital skills. So the 3 A's, access, affordability, and ability. And globally, only 55% of the people of the world have internet at home. So imagine trying to be included in COVID times, in work, in information, in seminars, in connectivity, social connectivity. Risk of homelessness has increased with crowding, people being moved on, temporary shelters, and sleeping rough. Prevalence of mental health has increased. And in disaster times, we know from past research that mental health is 2 or 3 times higher than the general population in areas that are disaster affected. And finally, we've all experienced across the world different supply chain problems, panic buying, production restrictions, transport and mobility restrictions has meant things like food security, security of basic medicines, and the questions around where does manufacturing shift? Do we do self-reliance effectively? In our local area, 30% of the workforce lost their jobs. First time that we have seen, we don't know the prevalence, people seeking government payments. We're lucky to have a reasonable welfare, social protection systems in Australia, visiting food banks to pick up food, seeking emergency relief, and so forth. We also saw that increase in domestic violence, and we also saw increased levels of mental health. 17% of our population in Cairns does not have access to the internet, and many do not have digital skills. We have communities that don't even have mobile phones, particularly in our Indigenous communities, who are very disadvantaged. Cairns is also one of Australia's hotspots for homelessness. Narayan has done a lot of research around homelessness in this region and elsewhere. He's, in a recent study, has identified that homelessness has increased in some locations up to 52%. Unable to afford rental, shrinking rental market, high rents, stretched social housing or non-existent social housing. 45% have said they have increased mental stress, and 96% have identified that they face an uncertain future in our region. In a national study of 15,000 people, 65% of women experience physical, sexual violence and harassment in Australia, trapped at home with their perpetrators, usually their spouses or intimate partners or family members, and not being able to report it. That's a very significant impact of COVID, either intensified violence or first-time domestic violence. And we've had panic buying in our region. Some of you may have heard the jokes around not getting things like toilet paper, but also more essential hand sanitizer and protective equipment for our health workers. And just quickly, there are, some of the other factors have been lack of access to appropriate healthcare, financial stress. Social isolation in Australia is very problematic because we live in a big continent and the population is spread out, especially where we are. Disrupted education. So these impacts are going to last a long time. Many of you will remember the global financial crisis of 2008. It took, on average, around the world, 8 to 10 years to recover from that. And so what are the lag effects of COVID? We don't know, but many of the economists, social scientists, scholars international agencies are saying that the impacts are going to be greater and recovery is going to take longer. And just in terms of conclusion for this section, COVID is going to affect people disproportionately. It's going to widen, we believe, have the risks of widening inequalities. It's going to create difficulties in bouncing forward and bouncing back, and hence the need for community engagement.
On time.
Okay, keep going.
Okay, so while Hurriyet just checks on
Another
time.
10 minutes.
Okay, so I'd like you to look at this ladder on your right, which it should be showing in the light, which is Sherry Arnstein's, way back in 1969, she talked about citizen participation. Now, community engagement, participation is one aspect of community engagement, but it's extremely important that we engage with governments, citizens, businesses, and communities across a range of things, starting from policy to the actual practice of what we do, to ensure that we can work with the most vulnerable and make a difference in terms of what we do. But how we do this is really important. Largely, we find now more and more, a lot of the work tends to be on the lower levels of these ladders. So the thing of, like go and see a doctor or go and see a therapist, informing people, giving people information, consulting with them without giving them feedback as to how the information that they've provided has been used, placating them. These are not really, this is not about community engagement. This is largely about managing people. If we want to actually make a difference in the long term, if we want to work with people appropriately, we will have to work at the higher levels of practice, which is about partnership, which is about power delegation, which is about citizen control of activities and processes. This becomes extremely important at times of pandemics, at times of disasters, that ownership of processes has to come from below. It has to be the people themselves who are part of the process. If they feel isolated and they don't feel engaged, the chances of any of these activities being of any use is very, very likely that nothing's going to happen. So participation is something we have to work towards. It's both an aim that we're working towards people coming together, and we use participatory process as a way of bringing people together to make a difference. And one of the most important things within that is the concept of trust, that people have to be able to trust their governments, governments have to be able to trust the citizenry, that bureaucracy has to be also trusted. And to build that trust, we have to use appropriate processes that bring people into the equation and ensure that some of the decision-making happens within the people and the communities too. I'd like to warn you also about technology. Today, technology is often being used for marketing or selling of particular kinds of ideas. We tend to get caught into a funnel where only ideas that suit us are fed to us, and we don't actually see stuff that's outside that. If you look at your Instagram, you look at your Facebook, we tend to get fed one kind of thing only. If you're a Trump supporter, you get only Trump stuff. If you're a Biden supporter, you get only their stuff. So that leads to a lot of misinformation. And this is something that we have to work towards challenging, that information is not just a one kind. It cannot be constantly filtered in this form. So we have to change the way we actually engage with people and the processes that we use. And the reasons for that are two. One is that we are trying, the overarching one is that development is not just about a few. When we work towards economic development, social development, whatever we do, it's not just about a few, that 1% of society benefiting out of it. It's about sharing equitably that the fruits of development are spread across the range of people. So one aspect of that is working across distribution, about addressing some of the material inequality, addressing some of the economic inequality, trying to build levels of equity within that all people can get some benefit out of it. Not to the same extent, there is differences, but nevertheless, that distribution is spread. Similarly, we also need to work towards building relational equity, that power is shared between us. We have a sense of belonging in what we do. We have a sense of inclusion in what we do. When we lose these things, as we see when systems change, when systems break down, we lose that inclusion, we lose that belonging. And the answer is not therapy, it's not straight away. We notice that whenever structures and organizations fall apart and turn to neoliberalism, the answer is straight away, go and see a therapist and the therapist will help you. That's not the answer. The answer is inclusion. The answer is inclusive social economic development. So we'll talk a bit more about that further down. Again, what are you working towards? Power is very much part of what politics is. And a lot of what communities are and individuals within communities are is lack of access. They have very little access to information, lack of access to resources, lack of access to decision making. Who takes the decisions about what I need? That becomes really important. And that's where, as in a process of good community engagement, we work towards building that power of the individual and the community, towards building information, towards resources, building power over relationships, and building power over decision making. All of these are central to making a difference to people's lives. At a time of pandemic, it becomes even more important because the vulnerable people can easily fall through the cracks. So to prevent that from happening, they need to have some level of access to power. So engagement has, again, as I mentioned, has two functions. One is about the individual and the community, about building their awareness, building their confidence, building their self-esteem, that sense of hopelessness to be replaced by a sense of hopefulness, to bring people together, to establish that sense of belonging. But it also has an instrumental function in that it's not just about attitudes, it's about doing something. It's about resisting change at certain points or encouraging change where it's needed. So when we are working towards dealing with the impacts of COVID, we need to be thinking about what are those actions that will actually sustain vulnerable populations? What are those actions that vulnerable populations can take for themselves? So it's not about others doing it for them, but people can actually do it for themselves. So when we're talking about this, there are three key areas. One is promotive, one is preventative, and the third is responsive. Promotive is straightforward. A lot of the things we get about wearing masks and social distancing and all of that is sort of within that promotive preventative area. It falls between the two. Straightforward. Say for promotive, it's about education awareness, providing information, doing advocacy where required, but also not just thinking about today, but thinking about tomorrow. How do we respond to challenges and issues that we may face in the future? We also have to think about who are the vulnerable and what do we do with them. And we'll talk a little bit about that further down. Talk about psychosocial support, the therapeutic approaches, work with communities. And some of the work that I'm doing now is particularly in this space about building social capital, building resilience within the communities itself, looking at strengths-based approaches that can build communities. Evaluating the effectiveness. When you change service delivery, what do you do? What things happen with that? Responsive is looking again, responding to what has happened. So what are the emerging needs of people? And they change constantly. So looking at the dynamic processes, how do we provide direct services? How do we provide information? Responding to threats. So it's not just one kind of thing. When we talk about COVID, we also have emerging threats of racism, for example. Chinese looking people, they don't even have to be Chinese, but Chinese looking people have been targeted in many parts of the world just because they appear to be from a country where COVID is supposed to have emerged from. So what happens in those circumstances to innocent people is things that we need to have to think about. We also certainly need to support other service agencies and look ahead in terms of proactive measures. I'm going very quickly just to try and finish up everything to the extent where we can take questions. In terms of disasters, sometimes there's a lot of conflating of what disasters are, and the pandemic seems to be fitting people are trying to fit it into that. It's not. Yes, there are certain characteristics such as, yes, it is a crisis. It has stages. It fits into the stages of disaster management. Similar communication and information aspects it has. Certainly different areas of the human services sector as well as all the other sectors come together. And that system of disaster intervention can deal with the initial impacts of COVID-19. However, unlike a tsunami or unlike bushfire in Australia, these are not one-off events that have ramifications. This is a continuing event. And we need to actually develop solutions that are ongoing and actually work with the changing situation. It has the potential, it has already spread globally. So it's not, again, tsunami, it's not bushfire, it's not a plane crash, it's none of those kind of things. It's much more than that. And so we need to develop skills and attitudes among the workforce as well as volunteers look at the fact that people are already getting tired. Many of the health professionals are exhausted with dealing with this particular situation. So there is a key difference in terms of these.
So another important element of community engagement is understanding social cohesion. Social cohesion is challenged at times of crisis. Narayan mentioned the attacks on Asian-looking people in Australia, but also elsewhere in the world. So social cohesion is critical. It's about how well we work together, how we marginalize or include people, a sense of belonging, that trust, that you feel a part of your community, that you feel you have equal share and equal go, equal opportunity. It encompasses many ideas. There are numerous definitions, so I won't go into it, but it's like things like social capital and civic and political participation, shared values, human rights, and including cultural elements, because, you know, Australia is, for example, very multicultural. Nearly 40% of the population is born overseas or the child of someone overseas. So feeling that minorities can belong. You might have indigenous people in your own countries. So those sorts of elements of inclusion are important. Many people dismiss this, but social cohesion is actually a key element in responding to COVID. If we are not a cohesive community, we will run into trouble, and it is particularly a predictor of resilience. How can we be resilient is how dependent on how well communities work together and how cohesive they are. Again, from a disaster regions, studies show that if you don't have cohesive, your resilience may go down by 20 to nearly 50%. It's a big factor, and we don't pay enough attention to social cohesion and the indicators of social cohesion. And in many places, COVID has raised issues against particular types of people or where they've come from, including China and Italy, wearing masks or not wearing masks, the degree of protection. In Australia, there's all these new citizen assertions coming up in terms of denying the impacts of COVID. So how do you then respect difference and opinion when people are undermining safety? So these are fundamental issues of social cohesion that are emerging globally linked with COVID. Both of us have talked about resilience. Resilience is a complex factor. We need to build resilience of our communities for the pandemic. No agreed definition of resilience. It's the way communities come back, become stronger in the face of economic, environmental, health, and other challenges. It's not only about coping, but it's about going forward and realizing the potential of communities. Many people have said, oh, we're going to bounce back to where we are. And others have said, no, where we are wasn't that good. We have to bounce forward. So these new concepts of resilience and bouncing forward are coming through as a part of what's called adaptive capacity. Building adaptive capacity is a key factor of building resilient communities. So resilient communities are able to take the shocks and disruptions to their lives as individuals, to their communities, to their families. And again, it comes back to similar concepts of social capital, attitude, sense of belonging, whether you're hopeful or negative, whether you have good leadership in institutions. So it operates at that individual level of individual factors, but it also operates at the community place-based level of skills and networks and connectivity and social connections, inspired leadership, systemic thinking, complex thinking, and having the institutional capacity and capabilities of your citizens to be able to go forward. These are all elements that make up for resilience, and many parts of the world are now trying to address and understand, well, what does resilience mean in our context? And so to be able to build resilient communities, you have to have community engagement. So we're coming to towards the end of it. We're basically saying that we have to redirect our engagement efforts along the lines of giving everybody a stake, engendering hope, looking at social protection, addressing market failures, building capacity, and making sure that we're well coordinated because everyone's doing something different in their own silos. So the new normal is what we have, 8 months, and it's likely to be prolonged. We see that crisis offers opportunities for major transformation, and building resilience requires us to engage from that crisis. Yes, we have to respond to crisis, but to moving towards a long-term sustainability approach without exacerbating the inequalities, making sure that capacities and capabilities are built, but that people have a stake in decision-making across the pandemic and building that adaptive capacity.
Given the time, we wanted to spend some time on these last 2 slides, but we'll probably go short on that. So some of the key things to remember is that number one is that the human rights agenda as it exists today emerged out of the Second World War. And there were key reasons why it came into place to protect some of the key things that we do. And it certainly provided avenues for a whole range of new ways of exploring the world around us, protecting the vulnerable, protecting numbers of groups across the world. We need to go back to that human rights agenda because nowadays there's a lot of attack on it. Attacks on the United Nations, attacks on the ways that we do things, the people who are protected. All of it tends to happen in the media today and by politicians. So that we need to go back to the idea notion of human rights. Secondly, work with the Sustainable Development Goals as they are to try and modify them in terms of working with this new normal. Can we change the way that we actually address those Sustainable Development Goals to make for new ways of doing things? The third is that the strengths-based approach is very much from many of the traditional human services, the idea that every community, every individual has strengths, and we can focus on that, and we can build on that. I've worked with small communities looking at those strengths, and I'm involved with one of those in Cairns at the moment, where we're actually making a difference by drawing on the strengths of the community. Also, we need to work towards social inclusion. So another approach that is very useful is the notion of including everybody, not just the large majority. That economic development, as I mentioned earlier, has to be about including the marginalized, has to be about socio-economic development for everybody. And a good rule of thumb is people like Rona should be the first people we work with, not the last people. The terminology often used is roll out. The terminology often used is from the center outwards. It's not. It's about we start with the last person. We start with the people with the most disadvantage and work from there. And this particular slide would probably be useful to think about, where the UNICENTER has actually structured it, that same notion of looking at disadvantage, starting from there, looking at cultural relationships, looking at partnership, growing the local into the larger context, looking at the total context, not just individual parts of it, using data and using data well to substantiate what we're doing, and building policies that will support it too. There's much more we could talk about it in this particular area, but I think we've really taken a lot of time. So we'll probably stop there. And, oh, there's...
So it's basically what we're saying is that there are marginalized communities, the risk of inequity and inequality. Recovery is going to require a platform for deliberation, iterative thinking, co-designing with communities, developing innovative solutions and delivering those. And engagement is at the heart of that. If we are not doing appropriate, meaningful, empowering engagement, we are not going to be able to achieve either recovery or resilience. And this requires cross-sector collaboration of government, the private sector, the community sector, and other stakeholders. This is our opportunity, like it was during post-World War II period with human rights frameworks that shape the next 50 years. This is our opportunity to really address deep-seated problems in the world. And I leave you with the quote from People-Centered Development: "A new economy of life and partnership is struggling to be born. The outcome is ours to choose." So let us collectively choose for a new outcome that is transformational. Thank you very much for listening to us.
I thank you so much. Prof, hello, Prof Babacan and Prof Gopalkrishnan. Do you still have time to answer queries from from the attendees? Are you okay? Hello.
Yes, Sylvia.
Yes.
I'll have to make my apologies after another 15 minutes,
Yes.
but
Sure,
Hurriyet
sure.
will still be here.
Yes.
And
Yes, sure.
if you have questions now, we'd be happy to take them.
Thank you. So, can you stop share the screen and then I can take over?
Can you stop sharing? Oh, it's at the top.
Okay. Thank you. I just want to share with you the questions that we received so far. You may pick up one or two or three questions that is listed there with the name of the attendees who asked the questions, who raised the questions. Please do so. Maybe questions number one, questions two, three, pick them up.
Sorry, Miss Alvia, could you please enlarge the view of Microsoft Word? Sorry for this.
Is that better?
Yes, better.
Okay, I might start.
Yeah.
Okay, so I might start by responding to the first one, which was Dr. Hautajalu's question about why women contribute more to the production in areas of poverty. Where are the men? A serious phenomenon. Suppose women and men work hand in hand. That is similar to the study by Dr. Elvia Shauki. So Elvia, they picked up on your research on that one. But yes, it's a vexed kind of issue. When you think about it, for example, in many of the poor areas that I worked, when it came to things like planting rice, for example, the women had to do all the physical work which involved the planting. They both, I mean, I couldn't do it. It was from morning to evening, they were in the paddy fields planting. The men's responsibility was only to do plowing, and that they're not doing the plowing, the bullock does the plowing, and the man guides the plow. So there's a very interesting thing about the kind of work that men do and the kind of work that women do. And that in effect could actually be a very interesting study in itself in terms of what that means in terms of volume of work that's done. I still stand by my comment because I still would say that from my observation, the kind of work that women do in the agriculture sector is the hard physical labor which they have to continuously do. And the men tend to have the more powerful work, but still tends to be, that power tends to be used in very strange ways in that particular thing. So yeah, that's still the point I'd like to make.
I might just contribute there too. The division of labor in the world is segmented according to gender. So the labor markets are like that. We don't have equal pay for equal work still in many parts of the world. We also have women's work being rendered invisible. So if you get a cleaner at home, you pay the cleaner, but if a wife is sitting at home and minding the children, we don't value that, it's rendered invisible, even though it has an economic value. So there's a study undertaken by an author called Marilyn Wearing, and she's called it Counting for Nothing. So it's not only just in the area of agriculture, but across many domains of our economy. And if we were actually to count the invisible work that women do across different spheres and equate it to what happens in the labor market, the gross domestic product will go up by somewhere between 20 to 40% in each country. So that is why the men are doing it, it's often counted. When women are doing it, it's rendered invisible. I want to now turn to the second question from Mr. or Miss Pramudya around building trust and influential figures are destroying it. I think that's, it's a very important issue you raise. It goes to the core of that slide around power, which Narayan shared with you. Information, power over information, power over resources, power over relationships, and economic power over resources. That is a fundamental problem in many communities. to be able to change that and build trust, and to be able to not let that level of intervention affect the outcomes, needs strong grassroots organizations, strong people who understand and are aware of what the situation is in terms of issues. If you empower people, Freya often talked about that self-awareness and more community awareness. That's one aspect. Secondly is the skills and opportunities to come together to discuss these. And three, to be able to build solidarity networks. So if you're able to do those at the local level around issues and grow them out, then you're becoming a powerful block within yourself. And if you're becoming a block, then those other powerful blocks have lesser influence to be able to destroy or change the nature of the outcomes you want. So it's really important. But also understand why people have got different agendas. Are there vested interests? Sometimes it's coincidental. So it's important to unpack who, what are the threats from the environment in building that trust and what's behind those threats. Unpack that as layers of onions, and to be able to then understand and build the trust with others that you don't often connect with. In most parts of the world, the social sector sticks together, the business people stick together, the medical, there's not often that cross-fertilization of the sectors. We call that integrated approaches. So part of building trust is also bringing the sectors together, because we speak different languages to mean the same thing. We've got to take different approaches. So the more you bring people together from different backgrounds, different disciplines, different professions, and different status of life, and come to a commonality of understanding, it will build that trust. Also dispel the myths. What are the myths that are happening in your community? Put that information out there. Is it against particular groups of people or minorities? Is it about the economic environments? So it's really fundamental that there's a lot of information about how you build trust, but it basically comes down to that awareness and dialogue and relationships to build that trust.
So I think you've covered everything on that question. So, but what I'd say, there are several questions that are medical questions. So we won't address them, which is like, can COVID spread through food, and the impacts of the virus in terms of the RNA virus and so on and so forth. That's not our expertise. The last question, which was COVID-19 spreading so fast, besides the medical aspect of it, the one key thing we have to remember is globalization is part of what we are today. We are very deeply interconnected with each other. And what that leads to is that risk that is in one place spreads very quickly across. So when a new virus type like this emerges, it will spread very fast across the world. And this is not the only one. There will be others emerging in the future too. So the number of interactions between people has gone up extraordinarily dramatically, and that leads to this kind of shared risk. Okay, coming back to question 3, could you give us an example of what country has already overcome the impacts at the global range, and how did they overcome that? And the third is what we can do in the community. Look, I don't think any country has already overcome the impacts at the global range. It continues to impact in different ways on different communities. Certainly, besides the direct impact in terms of health and the deaths in the community, the economic impacts have been really, really dramatic on communities across the world. And countries are working really hard at matching and managing some of that. And I think that some countries have done well. I mean, Australia hasn't done too badly in how it's addressed some of those issues. India hasn't done too badly on that. I think the United States hasn't done very well in terms of how they managed all of that. But I think the last question is what we can do in our community. I think community building, the thing of getting the people in the community together somehow, and physically, if it's not possible physically, at least through digital means. If digital means are also a problem, try and find some other approaches. Like, for example, in the local community, in a very poor suburb of Cairns, some of the work that we're doing on asset-based community development, we do it at one level through the digital means, but a lot of people get left out. So in that process, we actually need to have workers working with those particular groups of people, following still the restrictions that are in place, but still trying to ensure, for example, running classes for children in gardens so that the spacing can be kept and still people can learn and share information in those kind of circumstances. So we can do a lot of things at the local level to address some of the impacts of COVID, as well as strengthen the community to deal with some of the impacts of COVID.
I just want to also just quickly touch upon question 8 about land tenure gaps. I think that's a fundamental, one of the most fundamental issues for COVID-19. And then also question 6 around what can government institutions do. So land tenure, one of the biggest impacts of COVID is going to, especially in poor communities, is food security and impacts on livelihoods. Especially if they can't work in land, if they don't own land. So land tenure is fundamental. I think Narayan hasn't talked about his work, but one of the important things around addressing, land tenure issues are very complex across different countries. Land ownership, land use planning, particular vested interests in industrial development. So a whole range of issues come into land tenure, which we haven't got time to investigate here. I've done a lot of work on land tenure in the Pacific, very complicated processes, customary ownership, family issues, gender issues are big in land ownership, especially in traditional societies. So ultimately, it is one of the most fundamental issues for food security and livelihoods maintenance during COVID, especially as COVID is prolonged. One of the important things is to be able to look at what can communities do. And Narayan heads up something called Social Enterprise Network for the Tropics. So these are where communities come together and build enterprises, pool their resources, and in some parts of the world, they've been able to address land tenure issues. So you build your resources and buy land for yourself. You can use it for enterprise, you can use it for planting and agriculture. So one of the key issues is of community involvement in land tenure is to look at how can communities be enterprising themselves. Secondly is what are the problems of land tenure, especially regulatory and policy problems, often are fundamental barriers to land ownership. So address those by coming together and lobbying and advocating to your governments and other organizations. So there's a lot that the community can do around land tenure gaps, and especially in poorer areas, it would be critical during COVID to be able to look at that. In terms of what can government do, government institutions can do lots. They're responsible for social protections, and new social protections are needed during COVID. So one aspect is what does government do in social protection, and to be able to build social protective measures. It does not matter that governments don't have budgets. Everyone's talking about surplus budgets and budget deficits. Government budgets do not work like household budgets. They can borrow, they can have debts, they can have a whole range of things. So I think it's important, social protections. Secondly, what can government do is involve and support community capability building, build leaders, support with funding, support NGOs, support service deliveries, support hospitals and infrastructure development. So facilitate the development of responses at the local level. Government can't do it all. They're often not even in the regions or where communities are. They're often located centrally somewhere, don't have their outreach. So that's why it's really important for governments to be able to listen and engage and support local community. And the third element is governments need to listen and have a strong research base as to whether strategies are working or not. Now, there are a lot of monies and resources wasted in government. It doesn't hit the mark. So it's important that that community engagement in government takes place and that there is an evidence base to have policy actions. So they're just some immediate thoughts from us.
And just one thing I'd like to, two things I'd like to add. One is that when government responses have stopped, they really have to stop being so short term. That this COVID is not something that's going to go away. We have to plan for the long term. It's not just 1 year. There are many impacts that are going to last for a long period of time, and so the planning has to be long term. The other aspect, which I'm glad Hurriyet mentioned, is about communities taking on these things for themselves and combining their resources so that they can actually have better outcomes around things like land tenure, around things like, being able to do business that will provide income to them. And there is lots of opportunity in this. I mean, I always talk about the Seva Bank in India, which is a self-employed women's association, which started with women selling vegetables on the street. And today it's a huge bank that the women of Seva are the owners of that, and they are able to support so many other women in the process. So there's huge opportunities for communities to make a difference here. Thank you.
Thank you. A lot of thoughts and a lot of insights that were given by the two distinguished speakers. So I hope everyone, get a lot of uh, informations, new informations, as much that I also receive from this one. Well, it's about an hour now, the presentation. So I know that your time is very limited, and I know that you're leaving soon. So can we give a big applause to the two speakers, by showing your hands? And so thank you so much. And I'm going to ask you if you want to stay, you can stay. But if you want to leave, you're very free to leave. Thank you so much, Narayan and Hurriyet. And I wish
Thank
you
you,
all the
Hurriyet.
best. And I will share the materials, the PDF files to the audience later on. Thank you so much. Appreciate for your time. Bye bye. All the best. Take care. Um, okay, so thank you so much. Now we come to the second speaker. We come to the sessions where Prince Agwu from Nigeria is going to give his speech. So, Prince, are you going to share the file or you want me to share the files for the audience?
Okay, yeah, I can share from here.
Yeah, sure.
All right.
Time is yours, 30 minutes maximum for presentations. Okay, Prince?
Okay, so can you, I think I don't have the,
I give you the authority, so that's okay.
okay.
It's still on its way. Just do you want me to share your file? So it's coming, but it's not yet coming there. But it's
Okay. So I think if it's being difficult, you can
yeah, I
share
can
from
share.
there.
Yes, okay, sure. I can share it. The files to the audience. I'm taking
So can you
control.
see my screen now?
Yes, sure. Can you do the
Yes,
slideshow,
it's
please?
already here.
Okay, so you can
Can
see
you
it now,
take?
right?
Yes, sure.
Yes, I can see it.
Okay, all right. So I'll try as much as I can to be very practical. I learned a lot from the other speakers. Yeah, very beautiful um, presentation from the other speakers. So I learned a lot, and I'll try as much as I can to operationalize what they've been saying, in some kind of practical context. Yeah. So I'll be speaking on COVID-19 responses in Nigeria and the role of community engagement. So I would localize the context of whatever I'll be saying. Yeah. So we'll start by looking at a brief overview of the COVID-19 experience in Nigeria, and would equally look at what community engagement means. And so I was able to put a team together, and we actually went to the field. And we are still in the field, by the way. Yeah. So, but we have some findings from the field, and would say how we had to go to the field, what we found, and thereafter the conclusion. So I'll try as much as I can to be very brief. It's morning here, and about 4 a.m. in Nigeria, so I should be sleeping by now. But that's by the way. All right, so our first index case in Nigeria was recorded on 27 February 2020, and that was apparently the first index case in sub-Saharan Africa. And it was the coronavirus was found in an Italian, who came into Nigeria. And since then, it was more like we've been having confirmed cases of persons who have travel history. So currently, as at yesterday, that's 17th, we are currently having about 50,000 confirmed cases in Nigeria. Active cases are somewhat very close to 12,000. Recovered cases are about 37,000, and we have about 977 deaths. Yeah, so like I said earlier, that since February into early March and mid-March, we kept having persons who were confirmed as having coronavirus, as those who had travel histories to other countries. And it was much later, I think that was on 19th March 2020, 22 days since the first index case, we recorded our first community transmission, implying that at that point in time, the virus could now spread from person to person, especially persons who don't have travel history, who have never traveled out of Nigeria, and so on and so forth. Yeah, so because of that, the issue we are having in Nigeria, we had in Nigeria, and we're still having in Nigeria, has to do with our weak testing capacity. So within 6 months, we've only tested about 300,000 persons. And currently, I think I checked the dashboard yesterday, we've tested just about 352,625 persons. So about 1% of Nigerians, just below 1% of Nigerians have actually been tested for coronavirus. And this is as against 1.3% in Ghana. Yeah, so Ghana has really been doing wonderfully well with combating COVID-19. And somehow there are lots of lessons Nigeria would need to take from Ghana. Yeah, so as a result of the fact that we have this low testing capacity, there is need to a very large extent, enforce controlling the transmission, because we are not really testing so much. So that means you might have lots of persons with asymptomatic cases. And as a result of that, they just keep transmitting the virus, and no testing is done. You can confirm who has it. And so the attention should now be on controlling transmission of the virus. And that's where community engagement becomes very necessary. And so far, how have we been controlling transmission of the virus? We've been having lockdowns in our country. Just recently, we've been easing the lockdowns gradually. We are currently in the phase 2 of easing the lockdown. And we've been doing contact tracing in Nigeria, but however, the Presidential Task Force Committee on COVID-19 in Nigeria, they've been lamenting that there are lots of obstructions to contact tracing. In fact, sometimes you have persons who test positive for coronavirus and they run away. They run away from the isolation center. And so you keep looking for them, and they are out there transmitting the virus to people. And the government can't do anything. The NCDC find it very difficult to put these guys together. And that probably could be because of the fact that in Nigeria, we really don't have so much data concerning our citizens. Yeah, so there's this myth in Nigeria that COVID-19 is more like a class kind of disease. And so if you look at the pictures we have here, you'd see that all of these persons are elites in our country. The chief of staff, he died of COVID-19. A one-time senator equally died of COVID-19. A governor tested positive. The son of a vice president equally tested positive. And we have a top political party member who also tested positive. So these are just few images of elites who have tested positive to COVID-19. We have our Minister of Foreign Affairs recently tested positive. He just recovered. And so there are lots of elites who have been testing positive to the virus. And as a result of that, if you go into the community, they keep making you understand that this is not a disease for the poor, this is not a disease for the low income earners, it's a disease for the politicians, it's a disease for the elite. And this has affected to a very large extent how we've been able to manage COVID-19 in Nigeria. So you can see the people keep saying, is there any non-elite citizen who is in isolation or undergoing? Show us these persons. Yeah, and somehow, to a very large extent, at some point in Nigeria, there was the call for the media to go into these isolation centers and take a video coverage of these persons undergoing treatment in the isolation centers or treatment centers and put it out in the public, because to them, they feel like this it's a kind of disease not meant for the poor, and maybe perhaps government just framing cases up, maybe because of the funds attached to combating COVID-19 in Nigeria. Yeah, so so far so good. There are 6 images here, and it's to show a progress of what has been happening in Nigeria. So that I had to ask the question, have we progressed or have we retrogressed? So if you see the first image, you see that you have a lockdown situation. People are in their houses, people are not allowed to come out. And this should be this is actually in Lagos. Lagos is the epicenter of the virus in Nigeria. So we have more cases in Lagos state than in any other of the 35 states in Nigeria, including the Federal Capital Territory. And the 6th image shows at the point where they say, okay, let's now start easing the lockdown. And so you can see people who are out. If you look closely, you will discover that there are persons who are wearing face masks. Yeah, you know. However, you see that there's nothing like social distancing, no physical distancing. People are being put together, and one would want to wonder if these persons are actually vaccinated. You can see in the 4th picture, see how they are actually rushing to get into a bus. You can see in the 5th picture as well. You know, so all of these things are happening post-lockdown. Picture 3, picture 4, picture 5, picture 6 are all post-lockdown. So picture 3 shows that there was some kind of initial compliance when the government decided to ease the lockdown. But 5, 4, and 6 shows that to a very large extent, people are beginning to disregard caution, throwing caution to the wind and acting as though the virus is no longer existing. And in picture 2, there was actually lockdown in Lagos State. However, you can see some persons who came out to play football right at the center of the road. All right, so now this is more like a geopolitical spread of COVID-19 cases. Like I said, Lagos State happens to be the epicenter of the virus. And Lagos State is located in the southwest. And so you see why we have larger number of cases, more number of cases in the southwest as against other geopolitical zones in Nigeria. There are 6 geopolitical zones in Nigeria. And we have the southwest rating top when it comes to number of confirmed cases of coronavirus. Yeah, so the other speakers, they've done exceptionally well by trying to define community engagement. Basically, it has to do with the people. It has to do with involving the people. It has to do with a bottom-top kind of decision making. It has to do with ensuring that decisions, policies, take into context the communities for which these policies are made for. There's something about sustainability. Yeah, I remember when I did a course in community development, it was said that the idea behind sustainability or sustainable community development is to ensure that even when the persons who are somewhat initiating action, somewhat initiating policies, somewhat initiating a program, even when they are absent, the people would be able to drive these policies, these programs by themselves. And so in the context of COVID-19, yeah, so we've there are rules to follow, putting on of wearing the face mask, maintaining social distance, wash your hands, and all of these non-pharmaceutical procedures, and including the pharmaceutical procedures. All of these rules are well communicated, are being communicated to community members, perhaps not well communicated. And at the same time, we are now asking the question, why is it that this, you can see from the pictures I showed previously, these persons are no longer keeping to these rules. So that means that if there are no persons or no particular people to enforce these rules will die off. And it negates the principles of what sustainability or sustainable community development or sustainable community engagement is all about. So the idea behind community engagement is to ensure that the people are part and parcel of the decision making, and as well the implementation, and as well sustenance of the decisions that are made. Yeah, so basically, yeah, these are what we did to arrive at the content of this presentation. Now, so we have the big question: how effective is the relationship between government and grassroots in the charge against COVID-19 in Nigeria? Yeah, so talking about community engagement, there must be that strong sense of relationship between the government and the people. The last speakers, they emphasized so much on inclusion. So there must be that concept of inclusion in the context of the relationship between the government and the people. And we are now saying, I had to develop a model to say that in some way, in order for us to answer this big question, we must look at four things. We must look at governance. We must look at inclusivity. We must look at responsibility. We must look at outcome. Now, these four items, they do have a consequential kind of relationship, in the sense that if governance is not done properly, inclusivity would have a problem. If inclusivity is not done properly, responsibility would have a problem. And where there are gaps in governance, there are gaps in inclusivity, there are gaps in responsibility, then that means you're definitely going to have a very poor outcome or very bad results. Yeah, so it's a context-specific theory for community engagement and COVID-19 in Nigeria, which I had to develop in order to put a framework to my findings. All right, so I'm going to show two tables to give a picture of what the relationship between governance, inclusivity, responsibility, and outcome. So how we can now look at these four items to say if has there been community engagement really in Nigeria? Even if there has been community engagement, has there been some kind of sustainable community engagement? Remember what I said about if the people cannot carry on with these rules that are in place, in order to combat COVID-19. If these people can carry these rules on their own, then to a very large extent, we might start questioning how sustainable whatsoever engagement has been. So the first thing that we look at social media, mobile communication. And so what has the government been doing with these? So there's a daily report of the trend of the disease in Nigeria, information, dissemination of important information. There's this public communication between the NCDC and stakeholders. And so we are now looking at how inclusive is using social media and mobile communication to engage community. Yeah, the truth is, I think in some way we share some similarity with Keynes, as the last presenters pointed out. You can see that in Nigeria, just about 42% are on the internet. And of the 42% that are on the internet, we have just 13% that are on social media from Data Reporter. Mobile communication is at 83%. About 40% of Nigerians are illiterates, and we have about 50% of Nigerians who don't have access to power supply. Now, what this implies is that social media has been the major source of communication in Nigeria with respect to COVID-19. There have been as well TV presentations, the use of the use of the electronic media in Nigeria. But to a very large extent, if you look at the situation on ground, paying attention to the percentage of persons who have access to these devices, who have access to the internet, then you discover that there's a very high chance of exclusion. And so this process of engagement might just have covered a subsection of the population, a very minute fraction of the population, and not so much of persons might have access to the information that are being galvanized through these platforms. Now, in that case, what it means is that in Nigeria, we have traditional means of communication where we have the town criers. So these are people who they use some kind of a metallic object. They go into villages, they hit these metallic objects and trying to draw the attention of the villagers to whatever they want to say. And these guys usually have very loud voices. Then they make the announcement so that people will actually hear what they are saying. And from the process of the data we collected, we discovered that the town criers were sparingly used. And so you have, to a very large extent, I live within the suburb, and I've come to discover that you go to the market within the area where I stay and nobody's putting on face mask. Nobody's physically distancing. And so you begin to ask that question, are these people properly informed? The question is, to a very large extent, indeed, they've not been properly informed. Reason being that the epicenter for information is not connected to them. And even if it is connected to them, they don't have the wherewithal to acquire these devices, to fund data purchase. They don't even have the resources to pay for light bills and all of that. And so, to a very large extent, we must need to question the credibility of using social media and mobile communication to engage persons at the community. And so we talk about another component of engagement has to do with the special task force on COVID-19 being devolved to state levels. So in Nigeria, we have 36 states and we have the Federal Capital Territory. In other words, we have 37 federating units in Nigeria. And each of these 37 federating units, each of these 37 federating units do have some kind of special task force who try to engage the people on daily basis with respect to issues arising from COVID-19. So what have they been doing? They've been engaging with local groups, but however, the engagement they've been having with local groups, these engagements have largely been top-bottom. So it's more like when we went to the field and we asked some questions, the people just say, we do what the government say we should do. And so there's that absence of the government asking the people, what do you think can work for you? In essence, I know we've been having that argument about lockdowns, and we've been saying lockdowns are more like Western principles. And even if they aren't Western principles, most African countries, most low and middle income countries do not have the capacity to fund lockdowns, because when you ask people to stay at home, what it means is that you're shutting them away from their economic livelihood. And in that case, there must be the need to provide for them some sort of economic relief that would cushion the effects of asking them to stay at home and shutting them away from their sources of daily earning. So we've been having the issue of the people not really being involved in making decisions, and the issue of palliative. In the context of lockdown, the government somehow had to disburse some kind of palliative, but we have the problem of data in Nigeria. And in that case, what it means is that you give Mr. A palliative, whereas Mr. D should be the one in need of palliative. Meaning, given the fact that Mr. D happens to be poorer than Mr. A. And so we had this issue of, for instance, in Lagos, the government even had to share palliative there's a place called Lekki, it's a highbrow area. And it was so surprising that people who live there are more like the elites. And so why were the palliatives shared in such places where you have somewhat elites, living, in the state. And whereas there are some other places where you have very poor people staying there, and you go there and you give them one loaf of bread for like 6 members, of a family. You give them some very small bag of rice where you have about 10 people living in a house. And this issue of not properly documenting who are actually the poor persons in our country was indeed a problem in the course of disbursing the palliatives to them. Now, the other part of it has to do with there are no credible feedback channels, and so citizens hardly have the basic way. One way we usually vent our spleen in our country is more often than not on social media. And so we've made that argument as to how many persons in Nigeria who are on social media. But whereas there are some poor persons who don't have access to these devices. And so how do we capture their voices? Yes, they might have elected some kind of representatives to be at the National House of Assembly as legislators, but we have a very bad political system, a very bad political culture, a very bad political representative culture in our country. So these persons are elected to represent these persons, and at the end of the day, the people who are elected will remember those who had elected them when it is time for election. So there is that gap in communication, even between the legislators and the people that they represent. And at the end of the day, what we now try to have, or the outcome we are having, is more like a distrust in government. In fact, there was a case of a commissioner of welfare, social welfare, so who had to go to a place to share palliative. And as a result of hunger, she was beaten by the community people. And so they were like, she was trying to not share the palliative at that time. And the community persons were like, no, you must share it at this time. And if you don't share it at this time, we'll get angry. Of course, these people are very hungry. And we know that adage that states that the hungry man is an angry man. So there were so many cases of violence arising from, hunger, as a result of putting people in lockdown, shutting them out of their businesses. In Lagos, we had the 1 million boys or 1 million gang, who they even go to rob houses. They go to residences in the day to rob them. So these are some outcomes as a result of the fact that there's that absence of data to ascertain who are actually the poor persons in our country. There is equally that absence of feedback channel to communicate properly to government, citizens communicating properly to government about their feelings, especially poor citizens who don't have access to social media. And so the other part of it has to do with security. So this is really a problem, in our country. The security personnel were deployed to enforce safety protocols, as a result of COVID-19. But at the end of the day, we saw the security personnel somehow dealing and compromising the lockdown rules, the safety rules in one hand, and on the other hand, there have been high cases of police brutality. At some point, it was stated that when we had just 12 deaths from coronavirus, the security forces had killed about 18 as a result of police brutality. And if you pay attention to why were these citizens killed by security forces, it was simply a case of you should be in lockdown. You don't want to be in lockdown. You're now out. Pay a bribe. If you don't pay a bribe, go back to lockdown, or you face the consequences of being punished. And of course, there's this, when you're paying bribe, there's an exchange of money, and, exchange of money apparently implies exchange of the virus. And what we had in a particular state, the security operatives, about 10 of them tested positive to coronavirus. And we know that there are much more cases than what is in public domain. So we definitely should have above 10 as a result of the constant body contact the security guys had with citizens. And people are now talking about trying to, of course, recently there was a statistics released. You know, we are not proud of it. You know, our police force scored, I think, 127 of 127. So that means we have the worst, Nigeria has the worst police setting in the country. And the citizens who are expected to be protected by the security operatives, you know, as a result of some form of engagement, security is a part of engagement. These persons, the security forces are those abusing the citizens. So it is really a problem. So I need to run. The next part of it we have to look at is, okay, which is the last part, you know, NGOs and CSOs, what have they been doing?
Sorry,
what are the
Prince.
implications?
Sorry, Prince. You do have only 2 minutes to finish the slides. Is it okay? So that we can have.
Yeah. Okay. Yeah. I'm getting done. I'm getting done. So what are the implications for inclusivity and the responses? So we've seen how the non-governmental organizations and civil society organizations, how they should ordinarily try to protect the citizens, and they've been really doing very well, you know, with that respect. But however, there are cases of citizens not being aware of their services, and again, the issue of data comes up here. And at the end of the day, what we now try to have is, as the outcome, is the fact that there's an increasing case of sexual and domestic violence, and as well child abuse, especially within the lockdown. The last speakers made emphasis on that, where people who are abused are now in lockdown with persons who abuse them. And because of lack of awareness, these guys do not have a way of reaching the NGOs and the CSOs most of the time. And very importantly too, was that even the funds that were released, you know, to combat COVID-19 in Nigeria, the NGOs and the CSOs were somewhat in lockdown and could not monitor the processes of the funds. At the time when we start having post-lockdown, we started having increasing revelations of sharp practices within government. So there has been that corruption, embezzlement of COVID-19 funds in Nigeria. And while they were in lockdown, the NGO CSOs could not notice that, but at the time we started having post-lockdown, the NGOs, CSOs, they started observing the fact that these are things that have been happening all the while we've been in lockdown. And so on the part of the government, which is the last part of it, we've seen that our president hardly engaged the citizens, you know, throughout this coronavirus period. I think he has just addressed the citizens about 3-4 times, whereas the Ghanaian president has addressed his citizens over 13 times, you know. And so somehow people even looked at the president. Sometimes he comes out and he's not putting on the face mask. And so people kept asking the question, even if the president would not put on the face mask, what then do you think we should do? So there's really that distrust between government and between citizens. And as a result of that, there is the compromise of COVID-19 safety protocol in Nigeria. And somehow citizens are tending not to believe in whatsoever the government is telling them. So let's look at the next picture. The first picture is a typical example of a slum. The second picture is there's an election ongoing in a state called Edo State in Nigeria. And so you can see, this is just a very recent picture after the lockdown. And so these are the persons who are asking citizens to stay at home. These are the persons who are asking citizens to be safe, yet these are the persons flouting the rules. The third picture, you can see our president, he isn't putting on the face mask, and you can see the other persons are putting on the face masks. So how then do you think the citizens would want to, you know, follow whatsoever the leaders are actually saying? The last picture shows, we've made mention of increasing cases of violence. The last picture shows persons who are trying to draw the attention of government to whatever they are going through. And you can see a case of police brutality in the fourth picture. And so just to cap it up, social workers ordinarily should somehow help to improve community engagement. But in Nigeria, we have the issue of professionalization of social work. Yeah, so there are steps currently being taken to make the profession a profession in our country, and until those steps are taken, social work somehow faces some kind of discrimination from other professionals. And even when we asked persons who were some social workers who work in some medical social workers working in some hospitals, we asked them some questions. So far, so good. What have they been doing? And they were like, in fact, in some hospitals, the social workers were asked to go home. They were sent to go lockdown. Whereas these are the persons who should be engaging people in the community on how to stay safe and how to live within this period of COVID-19. Yeah, and we've seen how in India, okay, I want to make mention of something very important. In China, yeah, the undergrad social work students were asked to volunteer to help with community engagement. But in our own case, students are all at home. In fact, somehow they are tired. And in no distant time, they are trying to see how they can protest to the government to open the schools that they are tired of staying at home. And of course, you can see that if the government would be conducting an election within this period, having rallies where you have thousands of persons coming together, why then should the schools not be open? So these are some instances the students are citing, and even community members are equally citing. And in conclusion, we've seen that there's a weak relationship between the grassroots and the government in Nigeria. And so there's that high distrust of citizens in government. And the high distrust draws from weak accountability and corruption, absence of rule of law, and poor people-oriented feedback processes in governance. So most communication platforms in Nigeria tend to exclude the majority, hence the need for a complementary approach. We stated it where we made mention of how many persons who aren't on social media, percentage of persons who don't have access to power. And so if we must engage the communities in the way they should be engaged, and there must be a complementary approach between modern means of communication and traditional means of communication. So there is a social work gap in Nigeria, and this has affected the safety and well-being of Nigerians. CSOs and NGOs are indeed making very great effort, and we've seen how the lockdown compromised what they should have done. So what we are saying is that in the event of pandemics, in the event of epidemics, CSOs, NGOs, social workers somehow should be regarded as essential workers so that they can be able to monitor what government is doing, and most importantly, pay attention to the vulnerable who are actually at home. There are cases where some persons who were abused had to put calls across to some of these NGOs and CSOs tackling issues of abuse, but these persons couldn't make adequate response to the abused. And it's simply because of the fact that they were in lockdown and they couldn't, if they come out, they will be embarrassed by the police. And so all they had to do was to see how they can make these persons to the patient for a while until when it is safe to meet, safe to address their situations. And finally, for an effective community engagement during pandemics, attention must be paid to improve the process of governance. We've said it, scale up systems that will guarantee inclusivity to positively influence the response of citizens vis-a-vis the results of compliance and well-being. So we've, from what the framework I drew, there must be some kind of linkage between governance, participation, inclusivity, response, and outcomes. So if these four components are not well brought together, then to a very large extent, community engagement will be compromised and the outcomes will definitely be abysmal. Thank you so much.
Thank you. That was really, really insightful. I learned a lot during the presentations, Prince. And for me, for myself, for my research on educations, that words of inclusivity, it's so powerful that we need to be very, very careful in bringing up the students and to get engaged in class. So something that you can share and we can apply it to our research. I would like to share with you, Prince. I do have some questions, and so hopefully you can read it. Can you read it, Prince?
Okay. Yeah. So can you expand it a little?
Yeah, so that I can have all of them. So I can expand a little bit. So then I go with the first one. Is it better?
Okay. Yeah. So this is fine.
Yeah. Okay. So we you may pick up the questions from the list that I have prepared for you.
Okay. All right. So, um, okay, I'm going to start from Ibrahim Chandra. I'm sorry, I might find it very difficult pronouncing your names, so please pardon me. So the question is, how do we protect health workers? So I've been doing so many work within the health sector, particularly have been studying to a very large extent corruption in the health sector. To be very honest with you, the one way we can protect health workers is by stamping away corruption from the health sector. Yeah, that is really going to be a very Herculean task. It's not going to be very easy. So, however, we keep making mention of what is feasible to do. Taking away corruption completely from the health sector might not be very feasible, but somehow there are things that we should be able to put together, talking about insurance. Talking about, I know states like a particular state in Nigeria have to approve life assurance for their health workers. You know, what Ghana had to do was as a way of equal, because talking about protecting health workers, you look at protecting them from the virus, you equally look at protecting them economically, because you don't expect the health worker to spend a great deal of his time in the health setting and goes back home hungry, or goes back home to meet his child hungry, or the wife hungry, or the husband hungry. And so if you want to protect the health worker, it must be some sort of an all-encompassing approach, making sure that, yeah, they are protected at their place of work, and to a very large extent, their families are equally protected. So there's that need for physical protection, there's that need for economic protection, there's equally that need for social protection. The other part of it is the one question that is interesting here. Yeah, how can we reversing the country's economy as before? How can we face a new life after this pandemic? The truth is, this is not the first time a pandemic, is coming to our world. We've had, at some time we had the influenza here in Africa. We had the Ebola, at some point. Yeah, in as much as the coronavirus came with a very dynamic pattern, however, if we've been able to recover our economies in the past from pandemics, then to a very large extent, I'm convinced that the economies will equally recover after COVID-19. So it is possible that the economy would get better, after now. So it's just a thing of governance. Yeah, so that's why we need to pay attention to the persons we elect into positions. Yeah. And the other part of it is, yeah, okay, how can we face a new life after this? I said it, yeah, so pandemics have been attacking our world. COVID-19 is not the first, and it definitely wouldn't be the last. So to a very large extent, yes, we will definitely face a new life, we would learn it. We in Nigeria, we're already getting used to it. We put on the face mask. I have a hand sanitizer in my car. I have a hand sanitizer in my bag. So anywhere I go to, I'm sanitizing. So it's possible that, yeah, we can face a new life after this pandemic. So coronavirus, as the Tedros, the World Health Organization, DG, he said that the virus has come to stay, and we must just learn how to live with it. So we are hoping that the vaccines would be released quicker, than expected, so we can all get vaccinated, and keep on living our normal lives. So, so that means the question on when is the COVID-19 vaccine available? I just said something about that. Would you mind to share about the most efficient and effective community practice model that has been implemented and developed in Nigeria during this time? Hopefully, yeah. So, yeah, okay, yeah. That's by Getha Hati. Yeah, basically, like I said, in Nigeria, there is these very big distrust between government and citizens. Very, very big distrust between government and citizens. And to some extent, it's very difficult to lay your hand on a community practice model that is so effective. You know, at best, I can make mention of some other community practice models, that were used in some other times. For instance, I know in maternal and child health care in Nigeria, there's this organization, Society for Family Health, SFH. So what SFH does is they go to communities, they try
Prince, you unmute your voice. Prince, you unmute your voice. Yes, sorry.
Okay, can you hear me now?
Yes, yes, sir. We
Okay,
lost
all
you
right.
before.
Okay, yeah. So I said the question on best community practice model, someone raised. Okay, yeah. So I'm trying to bring up what we've done in Nigeria, but not related to coronavirus, but it's something people should learn from. There's a society called Society for Family Health, SFH. What they do with respect to maternal and child health care is they go to communities, villages, and they look out for persons they would consider as opinion leaders. They bring these persons together, train them, teach them on what maternal and child health care should be, trying to make them understand why they should access healthcare, and they deploy these persons back to the communities. And Society for Family Health, they've really recorded improvements in access to utilization of health facilities within the communities where they are operational. This same thing, one national urban reproductive health initiative in Nigeria, they equally applied this same tact. So the idea is Ghana is equally doing the same thing. Identify opinion leaders in communities, bring them together, galvanize them together, teach them, tell them what you want. These persons would go back into their communities and inform their community members. In fact, to a very large extent, the community members would listen to these opinion leaders much more than they will listen to you. So that was why, if you look at colonial history, the indirect rule which the British had to apply in most countries they colonized is just something very similar. So they govern the people through the people. So this same thing can be applied, across the board to increase community participation, and improve community engagement. What should people at higher risk of saying, okay, it's a medical question, I'm not a medical doctor, so I'm going to skip that. How do you respond to the fact that many people are starting to disobey health protocols because many think that COVID-19 is just an ordinary virus? Yeah, so I've made mention of getting opinion leaders, community opinion leaders together, put them together, teach them, send them back into their communities, and they will do the magic. Is COVID-19 spread in Nigeria affected by the high temperature there, and how the government reaches the very remote community? This is a case we are having in Nigeria. During elections, politicians usually have a way of going to the remotest of communities during elections. So you'll be so amazed that a community that seems not existing on the map, ballot boxes, ballot papers would get to those communities. And now we begin to ask, it is now a time when we have a pandemic. Why is it difficult for this same energy used during election to, adopt this same energy to the efforts, against COVID-19? Get these guys together, go to the remotest. If you can do it during election, then that means you can equally do it at any other time. So it's a problem we're actually having in Nigeria. So to be very honest with you, the government is finding it very difficult to reach the remotest of communities. But citizens are actually taking these responsibilities. There are citizens who are good-spirited, and they are looking for ways, finding ways to reach out to persons in slums, reach out to persons in the remotest of areas, and I can say that they are actually doing a very good job. The last presenter has made mention of the government wouldn't do everything, and I think citizens who are well-to-do can begin to take up some form of responsibilities. If the government can do it during election, they can do it during any other time. Citizens should try and see if they could do something in place of what the government would do. How are the steps taken by Nigeria in handling COVID-19 in the country from an economic, political, and social perspective? In Nigeria, from an economic perspective, there's a plan to revive the economy. We've revised our budgets. State governments, they've revised their budgets. There are plans in place to see how loans can be attracted to invest in infrastructure. Because the infrastructure challenges somehow were implicated during this COVID-19 period. And politically, I would be very honest, our government isn't so politically sincere. I don't even think there's any government in the world that is politically sincere. And so to some extent, there is the plane of politics with the coronavirus in Nigeria. Yeah. So somehow you find, I know of a particular state where the fellow who heads their task force had to resign because he was being cowed by a particular governor to increase figures of confirmed cases so he could get more money from the central government. So these things happen, So, but however, you have some states that are really politically, they want to do something. They try as much as they can to separate politics from health, but to a very large extent, just very few. And even in those very few, it's not completely ruled out that people are actually playing politics with the COVID-19 cases and with the COVID-19 figures. Yeah, so I don't know, is there any other question I'm supposed to take here that I haven't taken?
So far, your time is finished,
Yeah,
Vince.
that's fine.
Yeah, so I thank you so much. Audience, we do hope that our distinguished speakers today will share their paper. So I do hope that we'll get the paper by before beginning of November. So it will be published in the journal sometimes in December. So we really appreciate the shares, the insightful shares, and the insightful knowledge for all of us. I just want to add a little bit on these questions. Bella Qurani, because this is my area, and I think I like to address these questions. Um, so, with the existence of COVID-19, many activities have been stopped. Education is something that I'm dealing with, and I'm doing a lot with regard to the COVID-19, especially the case for Indonesia. For the unprivileged students, so those who do not have a good internet connections, Bella, we do have what we call in the online educations the synchronous and asynchronous method of online delivery. So in that case, the synchronous is the real time where you engage your students. What we are doing now is the synchronous one, but we can also deliver it using the asynchronous. So the asynchronous will be a better alternative if you deliver the learning educations, online learning educations, and that is not a real time. So whenever the internet is better, then they can have access to your material. So that needs to be a bit of outside the timing. So engagements may be a problem, but that will be maybe the solutions to that. And maybe because of the new norma, the new normal time, it's going to be a kind of a blended learning between the offline and the online, synchronous then asynchronous delivery of online teaching. So that is something that maybe we can talk a little bit later when we have the chance. So I do hope that I addressed all of the questions. Um, Professor Babacan is still here. do you want to add a little bit, or do you want to say appreciations to the audience? Please do so, Prof. Babacan.
Thank you very much. First to you for Elvia and the team for inviting us. Prince, thank you for your presentation, and audience, thank you for listening to us. I just wanted to, just listening to Prince, I think many of the issues are very similar, and even, you know, we took a higher order because there was so much, and Prince's presentation really supported many of the things we've said at a higher order with a lot of good lessons from practice. So I think many of the parts of the world, whether it's what we call the so-called developed nations or developing nations, face similar and different challenges. So I hope we can continue to work together and collaborate on addressing some of the challenges, but also in furthering our societies for good. So I really appreciate the opportunity, and I thank the audience for being patient with us.
Okay, thank you. I think that the last chance is that if everyone can show off their faces, and then we take a picture together. Tifa, are you okay? To invite everyone, and then maybe we can take a picture. And for my personal opinion, I'm so thankful. I get a lot of insights for my research. So we are very honored to have three of our distinguished speakers today, and hope to see you soon, maybe in another time. And I thank you and appreciate for your time. Tifa, are we going to be ready to take a picture?
Yes, I already asked everyone to start the video, but I don't see a lot of people start turning on their video.
Thank you.
If
Can
we're ready, I'm gonna take a picture of it.
Okay.
While waiting for the others, I would like to say thank you to Dr. Elvia for guiding us during this online seminar. Also, big thanks and big appreciation to all the speakers, Professor Hurriyet Babacan, Dr. Narayan Gopalkrishnan, and Prince Agwu. It is our great pleasure to have you with us. We have received a lot of useful and new informations. Also, a quick information before we end this online seminar. The AJCE will be having the third international seminar alongside with the JSD online seminar on 25th of September 2020. So make sure to save the date, since we already have lots of great speakers from different countries.
And also, we will share the materials in PDF files. How can we send it to the participants, Tifa?
I think I'm gonna add it to the Google Drive alongside with the certificate so they can access it easily.
Okay, good. Thank you so much. I will share all the materials in PDF files to the audience. Okay,
Yeah.
thank you.
Yeah, so Elvia, we need to especially thank the Nigerian community for participating. Yeah, because these guys must have denied themselves sleep.
Yeah,
Yeah,
I
to
think
participate.
4 o'clock in the morning. Appreciate
Mm.
that. Yeah, 4 o'clock in the morning. And you don't
Yeah,
look tired. You don't look sleepy at all.
yeah. So many thanks to the Nigerian community for participating.
Many thanks. Thank you so much. Yes, I can't tell one by one their names, but I really appreciate that. Okay, Tifa, are
Yeah,
you ready?
there's only like 9 people
Uh,
turning on their video. Is that okay to take a picture
yeah,
with
yeah,
this?
that's okay. That's okay.
Okay, so everyone smile. I'm gonna take a picture of it. Okay, I already take a picture.
Thank you so much, and thank you so much, and give a big applause on last one for Prof. Babacan and Agwu. Thank you.
Thank you very much.
Thank you. Bye bye.
All right, bye.
Bye. Bye. Bye, Hurriyet. Bye,
Thank you so
Prince.
much. Bye bye.
Bye. Assalamualaikum. Bye.